Hey everyone, welcome to KSSP Podcast. I'm Spencer.
And I'm Katie.
And today's series is gonna be going over the drug war. So, some questions that I had about the drug war that we will be looking into in the series include: if the drug war was effective, wouldn't we think deaths from fatal drug use would be declining and not increasing? We would want to see a decrease in drugs on the street and more people having access to rehab. And the drug war is ineffective at helping people not die from drugs. And if it's failing at its main goal, then what's the purpose of it? Unless that isn't the purpose, and if keeping people safe isn't the purpose of this drug war, then it begs the question, what is?
So, in today's series, we'll be discussing the history of the drug war, the problems it causes, and potential solutions. One important aspect to remember is that the drug war has its roots in racism, and we're going to be going over the evidence for this as well in our next episode. The history and roots of the drug war. And we're going to start with this video about the U.S. Prohibition era from 1920 to 1933. And who's the video by?
It is, Simple History?
Simple History, yes.
So,
U.S. Prohibition, 1920 to 1933. The growing temperance movement in the 19th century and the Anti-Saloon League had argued that drinking alcohol was damaging American society by destroying families and creating corruption. During the First World War, as America entered the conflict in 1917, Woodrow Wilson put a temporary end to the manufacture of alcohol to save grain for the war effort. Religious and moral reasons also fueled the desire to restrict alcohol. The anti-drinking movements took advantage of this to encourage the government to make prohibition a permanent law, and in January 1919, the amendment was ratified as part of the Constitution. Prohibition began in the United States in January 1920, after the 18th Amendment became effective, making the manufacture and sale of alcohol now illegal. Even though arrests for drunkenness initially declined, the law was very difficult to enforce as public demand surged for illegal alcohol. On top of this, there weren't enough prohibition agents to enforce it. Bootleggers found inventive ways of manufacturing and selling liquor. They created homemade moonshine or bathtub gin and smuggled it into cities and bars. Some bars became speakeasies. In order to sell illegal alcohol, they were secret. Because of the shared problem of prohibition, all kinds of people from different sections of society gathered in them. One such group that owned many of the speakeasies and profited from the prohibition were organized crime groups. Al Capone and Bugs Moran battled for control over the bootlegging and speakeasy trade, resulting in gang violence and a shocking crime wave across America.
This just all sounds so familiar, you know?
how so?
Like, there's just a lot of comparisons to be made between this Prohibition era and the drug war. Like you see there's not speakeasies for drugs, but the same problems there are trap houses. But yeah, the same problems arise. There's not enough people to enforce the law. There's never going to be enough people to enforce those laws because criminals are always trying to stay 3 steps ahead of the police. And people still get caught, obviously, but whenever, one dealer gets caught, 3 more dealers are going to pop up. And people are fighting over turf. There's violence, gang violence, cartel violence, over turf, over debt, things like that. You just see the same parallels with the Prohibition era. And,
I guess, yeah. That makes
and when
sense.
you examine the Prohibition era, you can see how it applies to the drug war and why Prohibition in general just doesn't work.
I would agree with that. And I guess I didn't realize, I think in the beginning, they mentioned that religious institutions wanted the prohibition. Why? I guess, do you know why? Why religions were against alcohol? I feel like...
it's part of the religious texts that,
all religious texts?
Not all religious texts, but there's certain churches that interpret the Bible as saying, there's not as many these days, but there's still some, I'm sure, but they interpret the Bible saying intoxicating your body is basically ruining your temple or whatever.
I assumed it was like a morality
It isn't. Yeah, it was definitely
cause
a
behind
morality
it,
thing.
but
I think he said that too.
oh, I guess I missed that part, but
Well, no,
I
yeah,
just never knew that, but it
yeah,
makes sense. Like, yeah, when you explain it, I guess,
and
think
also
about it.
just the morality of it, like pushing towards prohibition. Like people saying like using alcohol was immoral. Well, what do people say nowadays? Like a lot of people say using drugs is a moral failure.
Yeah,
Like it's just history repeating itself.
yeah, I'd say so.
In 1927 and 1930, there were hundreds of gang murders, with the most famous being the St. Valentine's Day Massacre in Chicago in 1929. Al Capone's men, some dressed up as policemen, killed several members of Moran's gang with machine guns while lined up against a wall.
Damn.
The murders were never officially linked to Capone. Eventually, Capone was brought down by a prohibition agent named Elliot Ness for violating prohibition law and tax evasion. In the same year, the Wickersham Commission had reported how prohibition had been failing. Many Americans never wanted the law, and prohibition agents were too few in number and easy to bribe. As well as this,
Yep.
it was clear that crime had risen rather than decreased before alcohol was illegal. In February 1933, Congress passed the 20
Right there, the crime increased instead of decreased during the Prohibition era. And I mean, we'll go over the evidence for this later, but I am going to say that as drugs tend to be decriminalized, crime seems to decrease according to what we found. So just pointing that out.
Yeah,
21st Amendment ending prohibition. During Prohibition, millions of dollars worth of business went to bootleggers instead of the brewing industry. Subscribe for more history videos.
All right.
Get Simple
Simple
okay.
history coming out with a banger. All right, so let's go over a little more of the basic history here. One thing about the drug war is that the FBI's illegal counterintelligence program used drug war policies to try to discredit the civil rights movement and attack members of the Black Panther Party and other Black leaders. And another fun fact, Nixon's domestic policy advisor, John Ehrlichman, said that drug laws allowed for permission to, quote, arrest their leaders, raid their homes, break up their meetings, and vilify them night after night on the evening news. He also said, did we know we're lying about the drugs? Of course we did. And in 1971, the year Nixon launched the drug war, he was recorded laughing with California Governor Ronald Reagan, as they called Africans monkeys and cannibals. So that's nice. Real nice. Later, when he became president, Reagan greatly increased Nixon's drug war and mass incarceration. So this seems to be more of a scheme of attacking political opponents than it is anything about safety or morality. But those two things are used in order to convince the masses that the drug war is the right thing to do.
Yes. And then I just also have a little more history of how the war on drugs was implemented in America. Just some acts and different things here. So we'll just start with products such as heroin were sold over the counter in a form of cough syrup until 1912. The Harrison Narcotics Tax Act of 1914 was the first U.S. law that restricted the distribution and use of certain drugs. On June 14th, 1930, the Federal Bureau of Narcotics was established in the United States. Due to the lack of restrictions in the Harrison Act of 1914, the Uniform State Narcotic Drug Act was implemented in 1934. This act was publicly supported by President Franklin D. Roosevelt. While the Harrison Act was revenue producing and provided penalties for violations, it did not give states the authority of exercising police power regarding either seizure of drugs used in illicit trade or the punishment of those responsible. And then in 1937, the Marijuana Tax Act was passed. And then the Comprehensive Drug Abuse Prevention and Control Act of 1970 was passed by Congress in October of 1970. This act categorized controlled substances based on their medicinal use and potential for addiction. A report on the growing heroin epidemic among U.S. servicemen in Vietnam was released in 1971 by 2 congressmen. And it turned out that 10 to 15% of the servicemen were addicted to heroin. And then that is also, I think, the year President Nixon declared drug abuse to be public enemy number 1. The DEA, Drug Enforcement Administration, was created in 1973 to replace the BNDD, which was the Bureau of Narcotics and Dangerous Drugs. When George H.W. Bush was vice president in 1982, he and his aides began pushing for the involvement of the CIA and U.S. military in drug interdiction efforts. And then, while I think a lot of blame gets placed on Nixon for the drug war, and I'm not saying he doesn't deserve any of the blame, it seems to appear that maybe Reagan has more blame for the negative consequence or actions, effects. So, the Nixon admin actually repealed the federal 2 to 10 year mandatory minimum sentences for possession of marijuana and started federal demand reduction programs and drug treatment programs. It was during the presidency of Ronald Reagan where we saw an expansion in the federal focus of preventing drug abuse and prosecuting offenders. During the first term of his presidency, Ronald Reagan signed the Comprehensive Crime Control Act of 1984. That act expanded penalties towards possession of cannabis, established a federal system of mandatory minimum sentences, and established procedures for civil asset forfeiture. The federal annual budget of the FBI's drug enforcement units went from $8 million to $95 million during the time period of 1980 to 1984 when Reagan was in office. Reagan appeared to be a strong proponent of criminalizing drug users during his presidency in the 1980s. According to historian Elizabeth Hinton, she wrote that he led Congress in criminalizing drug users, especially African-American drug users, by concentrating and stiffening penalties for the possession of the crystalline rock form of cocaine known as crack, rather than the crystallized methamphetamine that White House officials recognized was as much of a problem among low-income white Americans.
Yes. And then we have an article from the Drug Policy Alliance, A History of the Drug War. So we'll go over a little bit more of the history in detail. So the first anti-opium laws in the 1870s were directed at Chinese immigrants. The first anti-cocaine laws in the early 1900s were directed at black men in the South. And then the first anti-marijuana laws in the Midwest and Southwest in the 1910s and 20s were directed at Mexican immigrants and Mexican Americans. Today, Latino and especially black communities are still subject to wildly disproportionate drug enforcement and sentencing practices. So, in June of 1971, President Nixon declared a war on drugs. He dramatically increased the size and presence of the federal drug control agencies and pushed through measures such as mandatory sentencing and no-knock warrants, which, just going to say, no-knock warrants need to just be obliterated from any kind of police practice. They're just unsafe. They're unsafe for both the people who are being raided and also the cops. So
Yeah.
There's that. Then a top Nixon aide, John Ehrlichman, later admitted, "You want to know what this was really about? The Nixon campaign in 1968 and the Nixon White House after that had two enemies, the anti-war left and black people. You understand what I'm saying? We knew we couldn't make it illegal to be either against the war or black, but by getting the public to associate the hippies with marijuana and the blacks with heroin, and then criminalizing both heavily, we could disrupt those communities. We could arrest their leaders, raid their homes, break up their meetings, and vilify them night after night on the evening news. Did we know we were lying about the drugs? Of course we did." And that is a quote. Nixon temporarily placed marijuana in Schedule 1, the most restricted category of drugs, pending review by a commission he appointed later by Republican Pennsylvania Governor Raymond Schaefer. All right, and then in 1972, the next year, the commission unanimously recommended decriminalizing the possession and distribution of marijuana for personal use. Nixon ignored the report and rejected its recommendations. The presidency of Ronald Reagan marked the start of a long period of skyrocketing rates of incarceration, largely thanks to his unprecedented expansion of the drug war. The number of people behind bars for nonviolent drug law offenses increased from 50,000 in 1980 to over 400,000 by 1997. So public concern about illicit drug use built throughout the 1980s, largely due to media portrayals of people addicted to the smokable form of cocaine dubbed crack. Soon after Ronald Reagan took office in 1981, his wife, Nancy Reagan, became a highly publicized anti-drug campaign, coining the slogan, "Just say no." Great slogan right there. Definitely going to make people stop using drugs.
Oh, yeah.
Especially because of the fact that there's some people who want to say yes. You know what I mean? Like, they're not going to just say no. But yeah. It's fine, I guess. I guess that's fine. So this set the stage for the zero tolerance policies implemented in the mid to late 1980s. Los Angeles Police Chief Daryl Gates, who believed that casual drug users should be taken out and shot, and that is a quote, founded the DARE drug education program, which was quickly adopted nationwide despite the lack of evidence of its effectiveness. The increasingly harsh drug policies also blocked the expansion of syringe access programs and other harm reduction policies to reduce the rapid spread of HIV/AIDS, which, there were a lot of ways that he ignored the AIDS problem, an HIV problem, from what I understand.
Yeah.
Intentionally. And then, so George W. Bush arrived in the White House as the drug war was running out of steam. Yet he allocated more money than ever to it. His drug czar, John Walters, zealously focused on marijuana and launched a major campaign to promote student drug testing. While rates of illicit drug use remained constant, overdose fatalities rose rapidly. So the era of George W. Bush also witnessed the rapid escalation of militarization of the domestic drug law enforcement. By the end of Bush's term, there were about 40,000 paramilitary-style SWAT raids on Americans every year, mostly for nonviolent drug law offenses, often misdemeanors. While federal reform mostly stalled under Bush, state-level reforms finally began to slow the growth of the drug war. And then, in response to a worsening overdose epidemic, dozens of U.S. states passed laws to increase access to overdose antidote naloxone, aka Narcan, as well as 911 Good Samaritan laws to encourage people to seek medical help in the event of an overdose. Yet the assault on American citizens and others continues, with 700,000 people still arrested for marijuana offenses every year, and almost 500,000 people still behind bars for nothing more than a drug law violation. And that's out of about 2.3 million total incarcerated. So it's a pretty large chunk of people. And then President Obama, despite supporting several successful policy changes, such as reducing the crack powder sentencing disparity, which, if you don't know, basically, even though crack and cocaine are literally the same drug, when people who were caught with crack were given harsher sentencing than people caught with cocaine. And that was because crack was associated with the black community, while cocaine is more associated with the white community. So I just wanted to explain that. And then Obama also worked to end the ban on federal funding for syringe access programs and ending federal interference with state medical marijuana laws. Did not shift the majority of drug policy funding to a health-based approach, though. The Trump administration threatened to take us backward toward a 1980s-style drug war. President Trump started building a wall to keep drugs out of the country and called for harsher sentences for drug law violations and the death penalty for people who sell drugs. Yes, that's true. There have been people who have been given the death penalty or at least brought to court for that, just because they sold someone something with fentanyl in it. And, sometimes you don't even know your drugs have fentanyl in them. So, yeah, that's nice. And he also resurrected disproven just say no messaging aimed at the youth. And 2020 brought the additional challenge of COVID-19 pandemic, a public health crisis that exposed the systemic issues with our society and revealed just how deeply the drug war permeates these systems. People who interact with these systems are unable to take the most basic steps to prevent the spread of COVID-19, including those in jail or prison, the homeless, people with substance use disorder because they're sharing needles and pipes and all that, those who rely on access to medication assisted treatment or medical marijuana, and immigrants. During the crisis, it's harder for them to engage in social distancing and to access necessary medication assisted treatment, such as methadone or buprenorphine, aka Suboxone, or medical marijuana, as well as other health and harm reduction resources. So now that we've gone over some of the history about the drug war, let's look into racism and inequality. The beginning of the drug war, as the article we mentioned in the previous episode stated, was to target hippies and black people. So this war was never an issue of safety or lowering crime rates. In fact, they wanted to increase crime rates by arresting Nixon's political opposition. Today, black people are 4 times more likely to be arrested for marijuana possession than our white counterparts, despite comparable usage rate. So next we're going to go to an article on drugpolicy.org, Race in the Drug War, and just list off some stats here, some numbers. People of color experience discrimination at every stage of the criminal legal system and are more likely to be stopped, searched, and arrested, convicted, harshly sentenced, and saddled with lifelong criminal record. This is particularly the case for drug law violations. Nearly 80% of people in federal prison and almost 60% of people in state prison for drug offenses are Black and Latino. Research shows that prosecutors are twice as likely to pursue a mandatory minimum sentence for Black people as for white people charged with the same offense. I'm assuming with the same priors as well. It doesn't say, but that's what I would assume. Among people who received a mandatory minimum sentence in 2011, 38% were Latino and 31% were Black. Black people and Native Americans are more likely to be killed by law enforcement than other racial or ethnic groups. They are often stereotyped as being violent or addicted to alcohol and other drugs. Experts believe that stigma and racism play a major role in police-community interactions. So more than 250,000 people were deported from the United States for drug law violations between 2007 and 2012. More than 13,000 people were deported in 2012 and 2013 just for marijuana possession. 1 in 13 Black people of voting age are denied the right to vote because of laws that disenfranchise people with felony convictions. 1 in 9 Black children has an incarcerated parent, compared to 1 in 28 Latino children and 1 in 57 white children.
Yeah, that's crazy.
Yeah, no, it's ridiculous. That's not right.
No. And then I just have some information here on some other disparities too that are affected due to this war on drugs. And we're going to start with overdose disparity. So, low income communities and people of color are disproportionately impacted by this war on drugs, as we talked about. These groups already experience structural and systemic challenges, including discrimination, disinvestment, and racism. With overdose, there has been an exponential increase in drug overdose deaths, which has been partly due to the fact that the illicit drug supply has become increasingly unpredictable and contaminated. Between 1999 and 2020, estimates suggest that 1 million people died of a drug-involved overdose.
That's more people than some states have. I just want to point that out.
Yeah.
That's a lot of people.
So, with the overdose disparity, their racial and ethnic minorities have been disproportionately impacted by overdose deaths since 2015. The biggest increase in overdose fatality rates has been experienced by people of color, and people of color and natives experience the highest overdose death rates across the US today. And we may be wondering why. Well, a fentanyl contaminated drug supply can be attributed to this most recent wave of overdose deaths. Another reason would be drug prohibition. And then fear of punishment and stigma due to criminalization prevents people from getting support.
Yes.
Lack of harm reduction and treatment services for people struggling. And then, although those harm reduction interventions, which include supervised consumption spaces and heroin assisted treatment, has been widely studied and found effective outside of the US, these strategies have not been widely adopted in the US.
Yes, we'll definitely talk about that more.
Yes. So then I also have here on employment disparity. People with drug related convictions are often excluded from well paid work just due to having that conviction.
Yes.
Not really due to anything else, just the conviction. Well, I mean, there may be obviously other
Yeah.
factors that impact it, but just having that conviction is enough for some employment to deny you, which is obviously wrong on so many levels.
Yeah.
And then also housing disparity as well due to this war on drugs. So evictions often lead to unstable housing and or homelessness. And what happens to unhoused people who use drugs? Well, they're often forced into unsafe, unsanitary, and riskier injection and drug using practices in an attempt to avoid detection. Non-fatal overdose, infectious diseases, and syringe sharing are also increased with evictions and homelessness. A user and their trusted seller's relationship may be disrupted by an eviction. And you may wonder why that would matter. Well, it ends up making an already unregulated drug supply even more unpredictable and riskier.
So you may be wondering, why should I care? Like, these, people are committing more crime than the rest of the population. Well, more white people are becoming addicted to drugs as well. 38.2% of young white American adults, and this is with ancestry from Europe, the Middle East, or North Africa, aged 18 to 25, reported that they were currently illicit drug users, according to one study by the National Survey on Drug Use and Health in 2017. White Americans have the highest rates of drug use and abuse, despite having lower arrest rates for drug use than other groups. All in all, drug abuse is a national issue that we need to address with all groups, and we must address it carefully, precisely, and non-judgmentally. So now that we've looked into racism and inequality due to the drug war, let's look at how ineffective it has been in actually helping people in our next episode. So we're going to start off with a fun fact here. About 1.3 million of the 2.3 million incarcerated people in this country, America, the United States, are in state prisons for drug-related crimes. The most common crimes that result in incarceration are drug-related. The United States has the world's highest prison population, both per capita and in total numbers. This really makes you rethink the phrase land of the free. So Pew says that drug arrests stayed high even as imprisonment fell from 2009 to 2019. So we'll just go over some more numbers here. We love numbers on this channel. So drug possession arrests held steady at more than 1 million a year, in stark contrast with a large reduction in overall arrests, which dropped 29%. Only 1 in 13 people who were arrested and had a drug dependency received treatment while in jail or prison. Racial disparities in drug enforcement declined. Arrest of Black people for drug offenses fell by 37%, more than 3 times the drop among white people. And increased arrests of white individuals per possession of methamphetamine offset declines in marijuana arrests and drove the reduction in racial disparities. So, I would say that would be mostly poor white people. Just pointing that out. I would assume. So the numbers of people admitted to and held in state prisons for drug offenses both fell by about a third, accounting for 61% of the overall reduction in prison populations and 38% of the total decline in admissions. The decline in the number of Black people incarcerated for drug offenses made up 26% of the decrease in prison admissions and 48% of the drop in the prison population. Drug and alcohol related mortality rates increased 5-fold in prisons and 3-fold in jail, despite the decreases in the number of people in prison for drug offenses. So, okay. If I'm interpreting this correctly, I would only assume that this would be either due to withdrawals or contraband in the prisons. Like, whether someone's dying from withdrawals from like benzodiazepines or alcohol, or whether people are overdosing, which is also happening because contraband is snuck into jails and prisons pretty easily, actually. Happens a lot, in my experience at least. So that, yeah, they really don't monitor that well. So we're going to go to a chart here. This is possession arrests stagnated while drug sale arrests, numbers of people sent to and held in prison all fell by about a third over a decade between 2009 and 2019. So let's see. Possession went down 0.4%, and sales and manufacturing went down 32%, and arrests. And then prisons went down 34% in admissions and 33% in population. Next chart here. More people were arrested for drug possession than any other type of crime in 2019. So we can see here the drug offenses. Possession is about 1.35 million people, and sales or manufacturing is about 210,000 people. So that's about 1.56 million people altogether. Property crimes come next at about 1.07 million. Then simple assault, 1.03, DUI, 1.02, and violent crime, about 500,000. So the next chart here is arrests remained constant for drug possession but declined for other crimes. Percent changes in arrest and share of overall decrease by offense category from 2009 and 2019. So, all right. The total arrests went down 26%. Let's see here. And then property crime reduced by 38%. And the share of the total arrest decline was 18%. Drug sale or manufacturing percent reduced is 32%. And the share of total arrest decline was 3%. And then DUIs went down 29%, and the share of total arrest decline is 12%. Simple assaults went down 22%. Share of total arrest decline is 8%. So violent crime went down 15%, and the share of total arrest decline was 2%. And then drug possession, we see here, real tiny. It only went down 0.4%, not even a full percent, not even 0.5%. And the share of the total arrest decline is only 0.2%. And not even 0.25% there of the total arrest decline. So as we can see, there are arrests overall are pretty greatly declining, but the drug possession arrests are not declining, meaning that proportionally more and more people are in prison simply for drug possession rather than any other type of crime.
Or they are declining, but not by a lot.
Yeah, they are.
They are declining, yeah.
They are declining, but I mean, they're barely declining.
Yes, yeah, but they are.
Like, they are declining, yeah. I will correct myself there. They're declining. It just, in the grand scheme of things, like...
Not as much as they should.
They're not declining. They're barely declining at all.
Yeah.
So racial disparities in drug arrests fell in this next chart, but remained pronounced. So 2009 arrests. The blue is the black population and the orange is the white population. And remember that African Americans make up about 13% of the American population when we're looking at these numbers here. So we can just keep that in mind. And the 2009 arrests, 26% were black and 74% were white. And then in 2009, 22% were black and 78% were white. And then we look, okay, it was a little off. The population in 2019, black people made up 14% and white people made up 67% of the population. And that's in the youth. Sorry, I should specify that earlier, but that's the youth. Adults, you can see a little bit more of a disparity here. So black people made up 35% of 2009 arrests and white people made up 65%. Then we jumped to 2019, 27% of 2019 arrests and 73% were black and 73% were white. The population of 2019, black people made up about 12% and white people made up about 72%. So yeah, you can definitely see some disparities there. All right, and we're going to look at a graph here next. Rising arrests for methamphetamine offset decline in those for marijuana. So marijuana is in the green, methamphetamine and other dangerous non-narcotic drugs are in blue, and then in the pink we have heroin, cocaine, derivatives, and then in the orange we've got synthetic or manufactured drugs. So marijuana arrests did go down from about 758,000 to 500,000. And then we see an increase in the methamphetamine and other dangerous non-narcotic drugs. I don't know why they say that. It kind of implies that methamphetamine is a non-narcotic, but it is a narcotic. But I think they just worded that a little differently. So with methamphetamine and the other related drugs, it's about 242,000, increased to about 483,000. And then, of course, with the heroin, cocaine derivatives, it seems to be pretty steady here, only going up a little bit from 294,000 to 305,000. And down at the bottom, the synthetic manufactured drugs, 61,000 to 62,000, also remaining pretty steady down there. So yeah, we can definitely see that there's a lot more arrests with methamphetamines and the marijuana arrests are also going down, which I would assume the marijuana arrests going down would definitely be to states legalizing marijuana.
Yeah, I would. That's what I was thinking too.
And then there's the increase in methamphetamine use as well, which, yeah, I think like this is going to be a little opinion right here. So don't take this as a fact. But in my experience, methamphetamine users tend to often commit other crimes as well, getting them caught. But also, there's a lot of people just caught for possession. Not saying that because that does happen a lot. But I think like methamphetamine is specifically a drug that inclines people to commit more illegal activity. Just in my personal experience, related to other drugs, even related to like heroin or cocaine or crack. Oh, I don't know about crack, but definitely with like heroin and cocaine, like comparatively, like, and I mean, obviously, there's a lot of users that do commit other crimes, but it's especially prominent in the methamphetamine users communities. Like that's just my personal experience though. So don't take that as a fact. Just take that with a grain of salt. That's all. So then we've got next chart here. We've got a lot of charts today. Number of white individuals arrested for methamphetamine spiked during the 2010s. Arrest and by rate and substance, 2009 and 2019. So we see the marijuana arrests go from 67% white and 32% black and then 1% other. About 570. Yeah, we went over that number. And then 2019, it adjusted to 58% white and 37% black and 4% other. So it looks like the racial disparity for marijuana arrests specifically are increasingly targeting people of color more than white people. Like that trend seems to be increasing from these charts. But with methamphetamine use, in 2009, white people made up 80%, black people 9%, other 1%. And then we look in 2019, white people are at 81%, went up by just 1% there. And then black people 15%, and then 5% other. In 39 states, the number of people sent to and in prison for drug offenses fell by about a third over 10 years, from 2009 to 2019. So, right. The orange is percentage change in prison population, and the blue is percentage change in prison admissions. So it looks like the total prison population went down by 10%, and percentage in prison admissions went down by 24%. Meanwhile, the percentage change in prison population increased by 3% for violent crimes, but the percent change in admissions went down by 14%. Property crimes, we see the prison population goes down 27%, and change in prison admissions goes down 36%. Drug offenses, prison population change is 33%, and change in admissions is 34%. And finally, we have public order, which population increases by 3%, but the change in prison admissions goes down 8%. All right, and then the number of people in prison fell over 10 years, driven by a decline in incarceration for drug offenses. So the change in prison admissions and population by offense type, 2009 to 2019 again. So, right, the change in prison admissions, here are just the numbers of the populations here. We can just look at them. We just went over the percentages. So the orange is violent crimes, the blue is the drugs, green is property crimes, and then pink is the others. And then the number of black and Hispanic people entering state prison for drug offenses fell dramatically from 2009 to 2019. So this is by race and sex. So the white population of people entering state prison for drug offenses, for males, it fell by about 1,500. For females, it increased by about 3,400. Then we see the black people who are entering state prison for drug offenses. Males are at about dropped by about 31,000, and females dropped by about 33,000. And then Hispanic population dropped by about 14,000 for males and about 1,200 for females. And then the male population total dropped by about 47,000 for males and only about 1,000 for females. So it actually, it looks like more and more women are, it does technically decrease, but more white women are getting arrested. And then all the other populations are decreasing. So that's interesting.
Yeah.
And then we have the next chart here. It's the share of prison admissions that were drug-related varied widely across the nation. Drug offenses as a percentage of total admissions by state in 2019. So the U.S. average is about 24%. We see here it goes, this first color is 1 to 10%, and then 11 to 20%, 21 to 30%, 31 to 40%, 41 to 50%. So if you want to pause and look at this, you can look for your state and see how y'all are doing. My state's doing about average. Next chart, we have, in most states, the number of people in prison for drug offenses declined from 2009 to 2019, but 11 had increases. So this is the 10-year percentage change in drug-related prison population by state. So let's see. I'm assuming, I think the blue is an increase. Yeah, I think the blue is increased and then the orange is decreased. So once again, you can pause to look at your state. All right, and then that's all the charts we have from Pew today. And all right, so basically the US drug epidemic is just, I mean, it's getting worse. In 2016, about 64,000 Americans died from opioid overdoses. This is more than the death tolls for Americans in the Vietnam, Afghanistan, and Iraq wars combined. Meanwhile, in Portugal, where all drugs are decriminalized, the drug-induced death rate is 5 times lower than the average for the EU and is 1/50th of the United States. It's 1/50th. So that's like 2%. Its rate of HIV infection has dropped from 104.2 new cases per million in 2000 to just 4.2 cases per million in 2015. Drug use has declined overall amongst the 15 to 24-year-old population, the most at risk of initiating drug use.
Okay. And then, so I just have a couple more statistics, I guess, on incarceration too. The first one I have here is just another graph picture that just kind of gives another visual of how many people are incarcerated for, I believe it's, or it might just be offenses, I guess. It's from the Federal Bureau of Prisons, and it's offenses, and mainly you can see here the drug offenses are, number of inmates. So 66,677, which make up 45% of the inmates. So I just wanted to show that too. You know, we can have all the visuals today.
Yes.
And then just some more data information here too. Millions have been subjected to criminalization, incarceration, and lifelong criminal records due to this war on drugs. This has disrupted, if not eliminated, access to adequate resources and support to live healthy lives. Drug offenses, as we've talked about, remain the leading cause of arrests in the nation. From the period of the 1980s to the 1990s, incarceration rates for drug-related offenses skyrocketed. Over 1.1 million drug-related arrests were made in 2020, and the majority were for personal possession only. Estimates suggest that roughly 20% of people who are incarcerated are there for drug charge. Black people made up 24% of all drug arrests in 2020, despite the fact that people of all races use and sell drugs at similar rates. Incarceration rates for drug-related offenses have been decreasing, as we saw in recent years. This has been motivated both by cost savings and criminal legal reform efforts to promote a public health approach to drug use. Those with a history of imprisonment also earn 52% less than those with no history of incarceration, leading to disparity with wages once released. So, if people are being locked up for drug offenses, then the drug war must be effective, right? Well, actually, criminalizing people for drug offenses is a huge monetary burden. There's about $10 billion a year spent by states and the federal government to imprison drug offenders. Those estimates do not include the added costs that incarceration has on economic and social aspects. The Drug Policy Alliance in 2015 estimated the U.S. spends $51 billion annually on initiatives and policies aimed at fighting the war on drugs. These include, but are limited to, incarceration, probation, parole, and funding the DEA. In 2021, there are estimates that the U.S. has spent a cumulative of $1 trillion total on said initiatives and policies. So,
wait, so hold on. Is that all together or is that just in 2021?
No, I think that's all together. Like,
okay. Because, I mean, that's still a lot of money. that could
Yeah,
be used elsewhere, but okay.
since like probably 1971-ish, give or take, like when
Yeah,
they started it.
yes.
Yeah, that's a lot. Because what is, I mean, yeah. What is the national debt? Do you know off the top of your head? I know it's like,
I
it's,
have no idea. I'm pretty sure it's what, like 8 figures now or something like that, at least.
let me just Google it super quick.
Oh no,
I
it's
mean,
more like
granted, the debt
8 figures.
isn't bad, as we kind of discussed with monetary theory, but I know people
People
freak out
freak out
about
about
it.
it.
Yeah, even though we don't need to. But that's okay. I still want to know the
It's,
number.
but it's not about the debt. The problem with the debt is that we're spending the money poorly.
Yes. Um, I'm assuming this is trillion because it goes hundred
Yeah.
thousand million billion trillion.
What, like, I'm going to guess 14 trillion? That's just
31.
31. Oh, I was way off. Wow.
Yeah, I don't like this clock though because it says debt per
Oh, the
taxpayer,
debt
but we don't
clock?
owe that money. Nobody owes that money. It's we can talk about it sometime, like the how MMT sees it because I find it interesting. But anyways, so $1 trillion total, and I'm assuming since they started the drug war would be my guess.
Yeah.
Since it says like cumulative,
Oh,
but
yeah, that's true.
like I'm assuming just by 2021. So that number's probably gone up since I mean we haven't stopped the drug war yet,
Yeah, it's
So
been another 2 years. So, yeah, that number's
yeah,
definitely gone up.
because annually they said we spend 51 billion.
Yeah, and that's a lot of
So
money.
that's I don't think any of us will ever see that kind of money.
Yeah, probably not me.
Yeah. But so, as we can see, locking them up in prisons is a monetary burden. And while funding services and programs isn't necessarily a bad thing, it is a very wasteful way to spend when the outcomes lead to more crime, more drug use, more arrests, and more incarceration. So, here we have some examples. Because there are very few programs, if any at all, available in jails and prisons, and there is a lot of contraband in these facilities, recidivism rates remain very high due to lack of treatment and exposure to more criminal behavior. There is hardly any kind of rehabilitation within our jails and prison systems, if any at all, depending on the jail or prison. This means we are not doing anything to actually help prevent future drug use or future crimes. Researchers estimate 65% of U.S. prison inmates have an active substance use disorder, according to the National Institute on Drug Abuse, and yet few receive any form of recovery services. For drug trafficking offenders, rearrest rates ranged from 29.9% for offenders with 0 criminal history points to 74.9% for offenders with 13 or more criminal history points. And according to the National Association of Drug Court Professionals, 95% of incarcerated addicts use drugs again after they're released, and 60 to 80% will commit a new crime, often related to their drug addiction. Just as troubling, overdose is especially high once inmates are released from prison. This is because users who quit and then use again often overestimate their tolerance. Data from 2012 showed a 1% increase in the prison population. Data from 2012 showed that there's a 1% increase in the prison population, resulting in a 0.2.8% increase in the violent crime rate and a 0.17% increase in property crime rate. So basically, it's showing that as the prison population increased, there was also increases in violent crime rate and increases in property crime rate, although what you would think is that they would go down, but they were going up, according to the data from 2012. So that might have changed by now too. And then today, a large body of research backs those early observations, concluding that jail time doesn't discourage criminals from future crime. People who are sent to prison often reoffend. They aren't deterred by their time behind bars. All of those lead to, if not increasing, the costs.
In addition, doing drugs on its own isn't something that isn't, well, I mean, it could be physically harmful, but it's not inherently harmful, at least no more harmful than drinking alcohol is. Like, any argument you can make about sending people to prisons for drug use could also be made against alcohol use. And we already talked about how the prohibition ended up.
And if the drug war were effective, another thing we'd want to see is a decrease in deaths from overdose, because we would hope that, obviously, if the drug war were effective, it was helping people and preventing overdoses. So let's look at some information here. More than 932,000 people have died since 1999 from a drug overdose. In 2020, 91,799 drug overdose deaths occurred in the United States. The age-adjusted rate of overdose deaths increased by 31% from 2019 to 2020. So it was 21.6 per 100,000 in 2019, and then in 2020 it was 28.3 per 100,000. Opioids, mainly synthetic opioids, are currently the main driver of drug overdose deaths. 82.3% of opioid-involved overdose deaths involved synthetic opioids. This is due to the use of fentanyl in enhancing the high of opioids and illicit opioids. Drug overdose deaths involving psychostimulants such as methamphetamine are increasing with and without synthetic opioid involvement. So as we can see, the drug war has been ineffective in helping to prevent overdose deaths. And we will be going over preventing and managing overdoses tomorrow, too.
Yes. And we want to see an increase in rehabilitation. So according to Statista.com, from 2003 to 2017, the number of facilities has stayed the same. But if we really wanted to fight this war on drugs, we would create more facilities because these treatment centers are where addicts will really get help. So over the last few years, 2018 to 2020, it does appear that more rehabilitation facilities are being built, which would hopefully indicate that we're moving away from criminalization and towards rehabilitation. But to me, it still begs the question, why wasn't that even the goal in the first place? And when a police officer interacts with someone using drugs, they're not brought to rehab facilities. Instead, they are incarcerated and not given reliable resources to move towards recovery. Not to mention how pricey rehabs can be. Very few states have programs that provide free or cheap rehabilitation, and oftentimes these places have very faulty programs with low recovery rates. And I mean, the recovery rates are hard to track, so let's talk about that. Even though just about every rehab program promotes an 80% or higher recovery rate, these are based off of surveys that may include extreme cases of bias, where ex-patients are reporting to staff members that they want to look good for. You just don't always want to tell your ex-counselor when you've relapsed. You don't want to be disappointed in you. And how do you even measure the success rate of a rehabilitation center? If someone uses a drug just once after leaving rehab and then doesn't use it again, is that a success or a failure? For example, so we need to work not only towards building more rehabs, but regulating them more so that they will be as effective as possible for patients, and patients feel they can give honest feedback when surveyed. And regardless of the current state of many rehabs in the country, they are still very preferable to incarceration. I just really want to emphasize that. And as rehabs are focused on challenging addictive thoughts and changing behavior, whereas incarceration is focused on punishment for using.
If this drug war were to be effective, we would want to see policies implemented in the name of the drug war, supporting the health and well-being of individuals, families, and communities. Well, let's kind of go over here. Instead, we end up seeing policies implemented such as drug testing, mandatory reporting, zero tolerance policies, and coerced treatment that exacerbate harm in these very systems they are meant to help. Instead of helping those who may be suffering from drug addiction, as we would hope a said war on drugs would do, we instead see a prioritization and justification of drug prohibition, criminalization, and punishment. The focus being on the latter, we see negative effects in various social determinants of health, such as housing, education, income, and employment. The social determinants of health are the conditions and the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. There are many different factors that can affect the social determinants of health, one of those factors being the war on drugs.
Yeah, in addition to that, just with drug testing specifically, just my personal experience, drug testing is a kind of degrading experience. especially when someone has to watch you take the test. It's always uncomfortable for everybody involved, and oftentimes it just feels unnecessary. Of course, there are cases where drug testing can be useful, such as in rehabilitation centers, which are typically abstinence focused treatment. But there isn't any reason to bring the legal system or employment into the mix, or housing, or any of that. If somebody is otherwise obeying the law or otherwise performing their job properly, drug use shouldn't be monitored by these systems, as it is an irrelevant factor when all other duties are being performed. And it's also just a waste of money to monitor drug use when the person is performing their job, otherwise following the law, etc.
Yeah, I'd agree with that. And then there are also policies that have been implemented in the name of the drug war. So we're going to go over a couple of those here.
Yeah, so beginning in the 1980s, employment based drug testing became widespread. There's little evidence that these policies are effective in reducing drug use, improving workplace safety, or increasing productivity. Drug tests cannot specify how much of a drug was consumed. Well, at least the drug test the legal system uses. If you take a drug test in like a medical lab or something with a medical lab, then they can measure how much, to an extent. They can measure how much is in your system. So whether the person is currently intoxicated or impaired, the drug tests don't measure that either. And they don't measure if they have a substance use disorder. Drug tests cannot indicate if a drug use will impact a person's ability to perform their work or if they present a safety risk. And among the report's findings are that it costs $77,000 to find just one drug user by drug testing all employees. So that's a lot of money just to find one person. And the report, Drug Testing, a Bad Investment, also criticized studies which claimed drug users were costing businesses up to $100 billion a year. So yeah, that's just a lot of money that goes to waste. That like the government or business, whoever's doing the drug testing, like the government or businesses, like they could be saving a lot of money by just not doing that.
Yeah, especially if it does not appear to be helpful, then it's just a waste of money. Definitely. Yeah. So then we're going to talk also about housing and policies that have been implemented there. So the Anti-Drug Abuse Act of 1988 prohibited public housing authorities, or PHAs, from allowing tenants to engage in drug-related activity on or near public housing premises and deemed such activity grounds for immediate eviction. So let's go a little more into this here. Expanding on this, the Cranston-Gonzalez National Affordable Housing Act of 1990 made it so that if a tenant's family member or guest, regardless of whether they live on site, engages in drug-related activity, the tenant and their household can be evicted. Included in that act was that evicted households were to be banned from public housing for a minimum of 3 years unless the tenant completed an agency-approved drug treatment program or had been rehabilitated successfully. Building on these, Congress passed the Housing Opportunity Program Extension Act 6 years later in 1966. This added one-strike laws and expanded on the previous acts to give PHAs the authority to evict tenants if they or a guest was suspected of using or selling drugs, even if it didn't occur on the premises. The policies above require neither a drug arrest nor proof that a tenant or their guest was involved in drug use, sales, or activity. Landlords are also able to certify their property as crime-free by taking a class. This allows them to implement crime prevention stipulations in their leases that allow for immediate eviction should a tenant, family member, or guest engage in criminal activity, again, regardless of if it is happening on the premises. Then, regardless of whether the alleged drug-related activity is illegal, landlords working with law enforcement invoke these laws by claiming to enforce crime-free ordinances. There have also been instances of landlords evicting tenants following an overdose.
Yeah, so some states currently drug test their welfare recipients as well. This is both a waste of time and taxpayer money for everybody involved. Some states only drug test those applicants who have a history of drug abuse or dependence, while others are randomly drug tested. For example, Florida tests all of its applicants, even if there is no history or even suspicion of drug use. But in Tennessee, only one person in the 800 who applied for welfare tested positive. In Florida, during the 4 months the state tested for drug use, only 2.6% of applicants tested positive. Meanwhile, Florida has an illegal drug use rate of 8%, so the average population uses drugs at a much higher rate than welfare recipients do. This makes sense because many on welfare can't afford to keep up a drug habit. Far fewer can than within the average population at the very least. So the drug testing cost taxpayers more money than it saved and was ruled unconstitutional last year. So what can we do to help fight this type of discrimination? Because I'm just going to make this clear here. Like, addiction is a disease. It is a medical condition. I would classify it as a medical condition. So let's talk about solutions. So solutions for improving housing access include ending evictions and removing house bans based solely on drug-related activity or suspected activity, restricting landlords from using criminal background checks to exclude prospective tenants, and ending collaborations between housing complexes and law enforcement. Housing interventions that can improve the health of people who use drugs include investing in housing first programs and permanent supportive housing, providing eviction protection to people who call for help during an overdose emergency. So basically expanding 911 Good Samaritan laws and establishing overdose prevention centers.
Continuing the drug war is not a very viable option. So what else can we do?
Well, let's talk about increasing our police force funding and how that impacts the drug war, drug use, etc. So increasing police funding does nothing to address the issues of addiction. It only leads to more incarcerated people, not people receiving help for addiction. And additionally, increasing police funding ends up leading to more of a conflict between communities and their police force, as is often seen as threatening rather than feeling safe with more police around. And a better solution is to use funds that would otherwise be allocated towards the police to fund social programs such as detox centers, rehabs, and programs that monitor and promote safe drug use.
Another option would be to decriminalize drugs. It would help lower the cost due to incarceration/criminalization. We could then focus on rehabilitation and or helping people who are struggling with substance abuse. A step in the right direction, for sure, but not all the issues of the drug war or the drug epidemic would be solved under this policy. And not denying it wouldn't make things better, but I want our country to be the best.
I'd agree with that. So let's talk about legalizing drugs. This would put cartels and gangs out of the drug business, or at least significantly decrease their business over the American black market. And it would also decrease their power in the American black market. And this would also help prevent many overdoses, as drugs sold on the legal market would have to be heavily regulated. No more overdoses because you don't realize your drugs are laced.
And personally, I'm all for legalization, but having heavy regulation with that, especially on the drugs that have been shown to have higher addiction potential, and developing programs to help those who use those higher risk drugs. Just like marijuana and some over-the-counter medications, such as pseudoephedrine, have purchasing limits, we could, and if we were to legalize drugs, in my opinion, should institute policies similar to those.
Yes. And additionally, we could tax the sale of these drugs, just like we do for nicotine, alcohol, and in legal states, marijuana. And we could increase our GDP exponentially. And I also would want to mention, this is just what I think, once, if we did legalize drugs, we would sell them in specific stores, and we would, have the person behind the counter would be trained and educated in safe drug use so that if the person purchasing had any questions, they could be answered right there in the store, and it would also lead to safer drug use.
I agree with that as well. And then we could start more social programs, refer addicts to treatment instead of jails if they're not committing any other crimes.
So let's address some concerns here. Some people might say that if drugs are legal, everybody's going to start taking drugs and be non-productive and just like the homeless. So, first of all, most people don't do drugs solely because they're legal. And even if they did, you can make the same argument against alcohol. Why allow people to drink if there are people who become non-productive off of it? The truth is that whether or not someone is contributing to society is hardly based off of whether or not they use drugs or alcohol. It can depend on how much they are using it, but that's why we need more and better quality treatment programs in the United States. People can become non-productive due to any addiction, including food addiction, shopping addiction, gambling addiction, sex addiction. Should we ban all of these things as well? Prohibition also does not prevent the majority of drug users from using drugs. All it does is make it less safe and regulated, as we saw with the prohibition of alcohol. And honestly, just thinking of this now, you could even make the same comparison with abortions as well.
Oh, okay. Yeah. And while I guess I can see that being a valid concern, I do find that hard to believe that people who don't do drugs now would all of a sudden start using because they became legal. While there definitely may be people who want to try them now that they are legal, I personally feel a majority of people who are going to use drugs will use them regardless of their legal status. And there's conflicting evidence on whether or not the legalization of marijuana has led to an increase in its use from people who weren't using it before. And I feel a major issue with any of those surveys is the fact that a majority of people will not and would not admit to having used marijuana prior to legalization due to potential legal troubles leading to skewed results. But that doesn't inherently mean that it didn't lead to increased use. It's just important to consider the limits of these surveys, especially when attempting to use them to make claims.
Yes. And so now we're going to talk about the legalization of drugs and increase in crime rates. That's the next concern people might have. So we're going to look at legalizing marijuana. This is an article from MMP. Legalized marijuana has not led to an increased crime rate, but it has instead led to a decreased crime rate. So in this article, let's see. Government published data, academic research, and the experience of many law enforcement officials indicate that marijuana policy reform does not increase crime rates. Relying on statistics from the FBI's Uniform Crime Reports, peer-reviewed studies have analyzed changes after passage of both adult use legalization and medical marijuana laws. Contrary to assertions made by some opponents of legalization, there is no compelling basis for claims that legalizing marijuana and establishing regulated markets undermines public safety. For medical marijuana, multiple analyses have concluded that these laws are not linked with increases in violent crime or property crime. In fact, researchers from RAND discovered a negative and significant relationship between dispensary allowances and property crime rates. So, meaning that they are going down due to the legalization. So, other studies also point to marijuana policy reform as public safety benefit. In a 2018 analysis, experts at Washington State University found that police solved significantly more violent and property crimes after the passage of legalization laws in Colorado and Washington. Another peer-reviewed paper in the Economic Journal supports the argument that legalizing marijuana reduces crime by displacing illicit markets traditionally controlled by drug cartels and illicit distributors. All right. And then from Statista, we've got a little image here. So let's look at it real quick. Then and now, Portugal's drug decriminalization. Overdose deaths 1999, were 369 in 2016, goes down to 30. So it decreased by about 90% or so, a little more than 90%. And then new HIV diagnosis due to injecting, 2,907, and in 2017 we have only 18. And then the number of people incarcerated for drug offenses in 1999 was 3,863. In 2017, it was 1,140. So we can see here that overdose deaths, HIV diagnosis, and incarcerated individuals for drug offenses have all greatly decreased since Portugal's drug decriminalization. And then if we didn't reach out to them or go to, here's just something they said as well. So if we didn't reach out to them or go to the places where they're using, nobody would know they exist. Jonah Frias, a 26-year-old nurse working as part of the task force from the Portuguese harm reduction policy toward Fonseca. We don't judge them in any way. If they want to, in their own time, we can help them stop using. Under the 2001 law, drug dealers still go to prison, but anyone caught with less than a 10-day supply of any drug is typically sent to a local commission, which consists of a doctor, lawyer, and social worker, where they are educated on treatment and available medical services. And no distinction is made between hard or soft drugs where the drug use happens. What matters is whether the relationship to the drug is healthy or not. That is very important. Yes. They are also respectful of the patient's decision of whether or not to quit at that moment, or if that's a decision that should be made at a later time.
And then another concern, I guess, that people also may have is cartels. And with that, there is no way to fund police enough to catch and disassemble every cartel, gang, and dealer out there. The best way to get rid of these things, as we saw in that Portugal article, is to create a legal, or was it the Portugal one, right? Yeah, Portugal article. The best way to get rid of these things is to create a legal market for the products they sell, which is primarily
Although in
drugs.
Portugal, I do want to point out, in Portugal, it's only decriminalized. It's not legal.
Oh, okay. But even decriminalization helps.
Yeah, that does lead to better numbers for sure still.
Okay. And then because we live in a capitalist society, the most powerful thing we could do to take away power from cartels and gangs is to take away their market share by providing legal access to products previously sold on the black market.
All right. So how it would be better to stop it. So the best way to stop the drug war is to legalize and heavily regulate drugs. It would eliminate a lot of the street, gang, and cartel violence that is committed over drugs, and proper regulation would prevent a lot of overdoses from laced and strong drugs. We can see examples of this from places such as Portugal and with our state's marijuana reform laws and policies. Using logic and looking at empirical evidence, the best way to fix the addiction and overdose crisis in our country is to stop the drug war, legalize all drugs, and regulate them heavily, very heavily. So not only will this help prevent countless overdoses and keep us users safe, we'll also make a lot of money off of taxing the sale of these drugs, just like certain states do with marijuana and all states do with nicotine and alcohol. And like I've said before, any argument you can make against using or legalizing drugs, the same arguments can be made for alcohol use and sale. Look at the Prohibition era. We can clearly see that making substances illegal does nothing to stop people from using them. In fact, we saw an increase of alcohol use during the Prohibition era, showing that many people want to do something simply because it's taboo, especially teenagers who are more vulnerable to addiction and other developmental issues from drug use. I hope we one day live in a world where drug use and alcohol use are seen as one and the same. Something that some can do occasionally for fun, even if others find it to be addictive. And that's just me. In my personal experience, the worst factor of addiction is the environment the black market places you in. It is unsafe, untrustworthy, and it becomes your entire world. because of the perceived scarcity of these drugs, it puts your brain into survival mode and you end up making very rash decisions. If these drugs were available the same way that alcohol or in some states marijuana is, then we would be taking away a large portion of what leads to the addiction in the first place. Of course, I recognize certain drugs have physical and psychological dependency as well, but having these drugs more widely available takes away the feeling of scarcity in the marketplace and prevents that fight or flight decision making, as well as keeping the users much more safe in general. People wouldn't feel so much of the need to do these drugs on a daily basis and could instead plan out when they want to use these drugs in a safe environment without worrying about laced drugs. I'm not saying no one would ever be addicted again. That's crazy. No, I mean, addiction's still going to happen, but legalization would decrease or at the very least subdue addiction rates, just like legalizing alcohol subdued the rates of alcoholism.
Yeah, that makes sense. And I guess for me, I sometimes truly question if there are certain politicians have any empathy, because I find it harder and harder to believe they do the more topics we go over, while also knowing the stances they take on these topics. We, in my opinion, need to rescind a majority of the acts that were brought up today, like the housing ones and the other ones too. But the housing ones really stood out to me. Just that someone can get evicted because somebody is using, even if they aren't the one using, and even if it's not on the premises.
And the problem is that it's criminalized. Like, that's why all of these issues, because of the policies, and like you mentioned, and that, you know, if these drugs were completely legalized and not criminalized at all, then we would not have all of these discrimination issues with addicts and even recovering addicts too, because you can even quit using and still have a felony on your record, so you can't get housing or employment.
Yes. That's a big issue too, that people end up with a criminal record, which ruins their chances at good paying jobs and housing, like you said, and we said, and just it's just really harmful to
Takes
the
away
rest of their life. And then I was also going to say, there's one other thing that I just thought of that I wanted to mention, but it escaped me, but it might come back. Dang it. And I felt like it was important, but.
You want to think on it for a minute?
Well, what were we just talking about again?
About the criminalization, the housing and employment policies, evictions.
Why can I not?
I hate when that happens.
Yeah, because employment and housing overdose. It was something to do with a disparity, I think. Not a disparity, but just like it was the fact that a majority of people that get in trouble are just possession. They're not even dealers. Right. It's literally just a possession, which that is messed up in my opinion.
Yeah.
That doesn't help the actual issue, because in my opinion, the actual issue would be cartels and dealers, you know. Granted, I'm not going to say that, like, because obviously you want like a trusted seller, as we mentioned earlier, that getting evicted can ruin that relationship with a trusted seller, putting you at the mercy of more unregulated, like a less safe supply in theory. Like if you trust your seller to have like a safe supply and they test their, whatever it is.
Yeah.
So, but still, at the end of the day, if they think that the drug war is about using drugs and they don't believe in that anyone can use, if they believe in an abstinence only type situation will help the drug war, then they shouldn't be going after possession and throwing them in jail, because they're not the ones dealing.
Yeah.
Granted, nobody should be thrown in jail, but I'm just saying that it blows my mind that the majority of, and granted, I guess there wouldn't necessarily be a dealer for every possession, just because I don't think there'd be that many dealers, I guess. I don't know.
Right. There would be like a dealer for multiple possessions.
Yeah, but still, like the statistics, I feel like I mean, I guess maybe they are
But I mean,
representative, but I don't feel like they are. But either way, possession is just.
well, and it's a lot easier to find somebody with it's a lot easier to charge someone with a possession charge than a dealing charge.
Oh, it is.
Yeah, I mean, like first, it's easier to catch someone on a possession charge, first of all, because, traffic stops and stuff like that. Like, even if you are a dealer, like, you might even not even
Oh,
have your whole supply on you. So you're just going to get a possession charge, even if you are dealing.
I guess, yeah. And it's probably easier. I guess, yeah. It's harder to probably prove
Yeah.
dealing per se, because I think a lot of them
A lot of
try
it
to
just goes
use like, huh?
a lot of the dealing charges just go by the amount you have.
Yeah, that's what I was gonna say. And which that isn't, in my opinion, even indicative of
Right.
dealing either.
Like,
Not
I mean, some people just buy large supplies so they don't have
right.
to
Yeah.
continuously go back to their dealer as much. Like,
But
if they have
yeah.
money for it.
Yeah, no. And yeah, that's still just, especially like I feel like still, in my opinion, I mean, all of it should be about rehabilitation
Like,
and
even dealing,
their.
I
Hmm?
mean, all of the criminal justice system should be rehabilitation in general, anyways.
Yeah, yeah. Um, but
But
yeah,
especially with this.
rehabilitation, and especially in this case, just like you mentioned, like that article mentioned, that the relationship to the drugs being healthy or not is what is important.
Yes,
Yeah, I like that statement, that
definitely.
what matters is whether the relationship to the drugs is healthy or not. Because yeah, that's very important to understand, I think. Because I think a lot of people don't realize that.
Yeah. I mean, a lot of people don't realize that. I mean, there are people out there that use drugs that aren't like using them every day, that aren't addicted to them as well. There's people who
Yeah,
occasionally will recreationally use certain drugs, you know. But I mean, addiction is just more common, I think. I mean, not that addiction would never happen, like I said, but yeah, I mean, I just personally think addiction is a lot more common because of the environment it places you in.
yeah,
I mean,
I can see that.
there's also the physiological effects, like the physical and psychological effects of the drugs as well that do contribute to the addiction, but the environment makes it a lot
Definitely,
more
yeah. Yeah, like there is still definite, like even people who like were prescribed prescription painkillers and were overdosing on those,
Mm-hmm.
that was more of because of the drug, not because of the environment. So I would say it's a very, there's
Yeah.
like, it's a
So,
multifaceted
yeah.
thing.
I mean, the thing with the prescription drugs is like a lot of the people that addicted to their prescription opioids, especially with opioids specifically, like, I mean, they'll when they want more and more of it, and their doctor isn't going to just keep upping their dose as quickly as they'd like, they're going to start going to the streets to buy pills, and then they realize, oh my god, it's $20 a pill. I'm going to start buying heroin. That's how it goes a lot of the time.
Yeah, maybe so. Yeah, I wouldn't say every, like,
Not no, not every
yeah,
time.
okay.
It does happen a lot though.
Yeah, I mean, I'm just tired of certain groups of people having inhumane powers over others. As being leaders of this country, they should be taking care of its citizens. Because one way that I see the government is kind of as a parent, the parent should be taking care of its children. Us, the citizens, are technically their I know we elect them, so it's obviously different than an actual parent-child relationship,
Yeah.
but it's still, to me, I would assume that a government should take care of its citizens. And also, just taking care of your citizens is going to help the country overall be, I guess, more productive, if you want to say
Oh
that.
yeah.
Depending, I mean, granted, there's obviously, we've talked about multiple, like, money isn't the only way to generate productivity, but a lot of people think it is. So even just supporting the basic needs would increase GDP too, overall too. If that is your only concern with productivity, taking care of your citizens, keeping them healthy, making them happy, I would encourage them to want to do things, which would most likely then increase the GDP overall. So it's just beneficial if the government were to take care of us and meet our basic needs. Over, like, I just don't. It's
Yeah.
hard for me to see why they don't see
Right.
that. And I get there's greed and corruption, but even at the end of the day, if they still wanted to be greedy, they still could, and they could still meet our need. Like they could still please the citizens and be greedy, you know? They could do it all if they wanted to.
Yeah, and
So it just blows my mind that they don't even try to please the citizens, you know?
like we're the ones paying our tax dollars into this system. Like you would hopefully would get something out of it. Like that's the whole point of paying taxes is to get something out of it for the citizen, benefit of the citizens. And that just does not happen with a lot of the money that we spend.
Yeah, especially with them wanting to cut programs too.
Oh yeah.
But yeah,
Yeah, let's just buy more tanks that we're never going to use and then blow them up in whatever country we're invading next. And never use them. That's great. Great use of the money, guys. Good job.
Yeah.
So, yeah. I mean, that's all I had to say.
So, yeah, that was our mini series over the drug war.
Yeah, and now we would just really like to thank everyone who's been watching, liking, and sharing. We just want you to know that we really do appreciate you.
And also that we are just really excited to have you guys along on this journey with us as we see where this podcast takes us and see where it goes. And as always, you guys can leave comments below if you have ideas on things that you guys want to hear.
Yeah, you can find us on Facebook, YouTube, Instagram, Twitter, and TikTok. We do also occasionally Twitch live stream, so follow us there to be notified when we do.
And don't forget to give this video a like, as well as follow or subscribe to our other social media accounts. And don't forget to turn on notifications so that you get notified of when our new content comes out. Otherwise, we will see everyone next time.